Masters in Logan Motivational Media presents Dr. Jack's Pulse Nation with noted cardiologist Dr. Jack Hauser answering all your questions. And now, the man of the hour, Dr. Jack.
Hi, I'm Dr. Jack Hauser, and welcome to Pulse Nation. For the next few minutes, I'm going to be your new best friend. We have some questions about your heart, your health, and living, and let's get right to it.
And stress and anxiety and chaos and getting through it all. Stress seems to be running rampant. Everybody's talking about stress. Everybody's talking about different ways to reduce stress. Doctor, why is it that we're living in such a fast-paced and digitally conscious, just chaotic world of stress? And we talk also a lot of times about how stress can really affect our health. Tell us about the connection, and why do you think everything's so ramped up these days?
Well, I think the real answer is a sociological one, which I don't think I need to expand upon, but essentially the economy is pretty much in the toilet. College costs are through the roof, and yet we encourage all of our children to get the best education possible. Food prices are out the door. Women are trying to become primary breadwinners. There's such an inequality of that. We're all worried now about global warming. We're using up our natural resources. We still have lots and lots of disease. And, you know, it goes on and on and on and on. So if you are a typical American adult, you're trying to raise your family, take care of yourself, eke out a little bit of recreational time, maybe even just read a book or the newspaper, have a cup of coffee, make a living, take care of your mortgage, pay your bills, guess what? You have a lot of stress. So unfortunately, I can only say that, yes, stress is ubiquitous. Anxiety is universal. It's everywhere. It's in all of us. And as a cardiologist, I do see a lot of it because oftentimes stress and anxiety, depression manifests themselves in heart disease.
So it's the buildup of this stress and not being able to release it and deal with it effectively. So everybody obviously deals with stress, in different ways. We do have an email that came in. This is from Josh, and it looks like he's in just outside Boston in Newton, Massachusetts. He said that he's tried everything he can to relieve stress. He runs, he does this, he does that, but nothing's working. He still gets fired up quickly. He still gets bottles everything up, and he feels symptoms. Sometimes he gets, tight chest, it looks like he says here, a little of the acid reflux. So he's getting physical symptoms, obviously. You can't ignore that, can you?
No, and very often people do not say, gee, I think I'm having anxiety or I think I'm stressed, even though they are. But when they come to my office, the cardiologist's office, the heart doctor's office, they're not coming because they have stress. They're coming because of some physical symptom that they are presenting, such as chest pain. I can't tell you how many patients come to me or are referred because of chest pain. And yet, I know beforehand that they're not going to end up having coronary disease at that time. And yet my job then becomes not so much as a cardiologist, but as a comfort measure, as a cheerleader, a therapist, I guess, to rule out underlying cardiac causes and use that for reassurance. So when someone comes complaining again of palpitations or dizziness or chest pain, passing out, many times it has nothing to do with the heart. But we don't know until I actually work them up for that. And then our job really is about addressing their levels of anxiety, stress, and depression.
What about the difference between anxiety and stress? There are differences between the two, right? Does anxiety cause stress? Stress cause anxiety? They're working in tandem. Can you separate a little bit of the two?
Well, stress is not necessarily a bad thing. There's something called the fight or flight reaction, which actually saves our lives on many levels. It's a very primordial response to environmental dangers. As an example, when our body is under acute stress, such as if we're about to be mugged on the street, we know that the blood vessels that go to our stomach and our kidneys may constrict, because we don't need to pee and eat at that time. The blood vessels that go to our muscles are opened up because we have to get a lot of blood flow and oxygen to our muscles, because we're going to be running. Our pupils, believe it or not, they become widely dilated. We start sweating. These are all involuntary responses to stress. But as you can see, they are a means of self-preservation. When we have stress reaction that's not commensurate with our environment, if there's no mugger chasing us down the street and yet we have similar symptoms, then we probably need to seek help in what it is that's causing the stress. Many times it would be an internal or free-floating anxiety. And again, we would search for an environmental reason. Did you just lose your job? Did you move? Did you lose a spouse? Whatever it might be. Those are something that, again, we would talk over, refer to professional counseling. But many times it is just a free-floating internal level of anxiety that we would then help to allay after we rule out any underlying cardiac causes. But I do want to say that it's not so much the underlying cause of the stress. For me, many times it's the actual effect of stress and anxiety, whatever that cause or trigger may be. So for instance, if someone comes to me with blood pressure of 200 over 110, many times we look for a particular reason, we don't find it. That's usually the case. We then are left with saying, gee, let's talk about your lifestyle. And it's amazing how much anxiety and stress the typical patient has. Is that the direct reason for having hypertension? It's easy to say yes. Do I need to treat the underlying cause? Well, that would be up to, again, to professional counseling. But for me, as long as that stress and anxiety persist, so will the high blood pressure. And I cannot allow a stroke, a heart attack, heart failure to occur, so I would need to address that from a cardiac point of view.
So that's basically what happens when they come in to see you. You go through these different, it's almost like a checklist of things that might be potentially the underlying causes of this stress, of this anxiety that somebody's dealing with. We got another email in here. This is from Judy. She's over on Long Island. She's in Huntington, Long Island. And she said that her child seems to be, has anger management issues and is always getting, ramped up very quickly and very angry very quickly. Is that a precursor for physical problems as well as maybe psychological combination? Physical problems. She's worried that that might be like a little bit of a cue that this child is going to have problems later on in life. And what would you say to somebody like that who's experiencing that with their child?
So are we saying that the mother has the stress, or that she's worried that the child's
in the child now at a
behavior,
young age,
the child needs help
now.
now.
Right.
Yes, needs professional help right now, whether it's behavior modification, cognitive behavioral therapy, whatever wonderful techniques child psychiatrists, psychologists are using today. But I would get help for that child immediately, and of course take a good look at her family and the dynamics that are operating there.
As well. Here's another one. This is from Brian, and he is in Holyoke, Massachusetts. He said, let's cut to the chase. And I know you appreciate that because that's you to a T. What can be done? He said, what can be done from a medical point of view to alleviate stress and anxiety. He says he's so confused because he hears so many different things. Everybody's coming up with a quick fix all the time. Just do this and your stress goes away. Just take this and your anxiety goes away. But it's not so simple. So what are some steps, some tips you have for Brian in Holyoke?
Well, there is a complete armamentarium of interventions that I would present to my patient who is really stuck in a rut of anxiety and depression. First off,
I just want to say I love that word, armamentarium.
Oh, I thought you liked the word rut. I thought that was the word that you liked.
Armamentarium, it's a good one.
Okay.
I'm going to include that in my vernacular.
Thank you. Very militaristic. Sometimes I feel that way when I practice medicine.
And humor is essential too. We'll get to that in a minute. Humor, I know, is big. But
Thank you, but I know that my patients are never perceived as enemy combatants. Okay, I'm always an advocate for my patient, and maybe that's one of the reasons why we are here today.
That's right.
But again, it's very frustrating. There oftentimes are not solutions to why someone has such stress and anxiety. Really, more to your point, or this gentleman's point, is what do we do about it? Okay, whatever the cause, I want you to fix it. And my job as a heart doctor would be first to make sure there is no underlying cardiac reason for that. Do you have an arrhythmia? Do you have atrial fibrillation? Do you have perhaps some tumor that's secreting a lot of adrenaline? There are certain things that we would want to make sure are not there. Then, of course, we would integrate the help of a psychologist, psychiatrist, a therapist, social worker, what have you. And ultimately, I would then want to make sure that the manifestations of the stress, anxiety, whether it be palpitations, chest pain, high blood pressure, do not physically affect his health. So I wouldn't necessarily prescribe cardiac medications, although if your blood pressure is particularly elevated, again, from whatever reason, I would be apt to prescribe a blood pressure medication for that. In addition, there are so many interventions to combat stress and anxiety. And some of them are very simple and all around us. Sometimes we take them for granted, and that would be eliminating alcohol. Believe it or not, sometimes I would say, go have a glass of red wine with dinner. For those that drink in excess, I would say, drink less. So again, it's a kind of a double-edged sword in that regard. Good night's sleep is extremely important. Exercise is unspeakably paramount to reducing stress.
You can work out some of the stress too as you're doing the physical exercise. If you are all hung up on something, the physical movement helps you almost release it, right?
Right, absolutely. Even an obese individual, I would recommend to exercise, not so much for weight loss, but for stress reduction. Okay, and that's really about what's being fit, both psychologically, emotionally, and physically. There are so many other good eating, eliminating excess sugars and sweets and starches, counseling, smiling, talking, sex. Here's a good one, okay? Let's not forget about sex. There are some studies that show that a healthy sex life actually adds longevity. And so there's another thing. And then, of course, there's hypnosis, there's biofeedback, there's Reiki therapy, hot stone massages, visual imagery. So as you can see, it's a tremendous list that is available to us to help combat and alleviate what could be a very debilitating state of anxiety and stress.
Getting back to humor, I know you're a big believer of the importance of humor in our lives just generally. How important is it to laugh, to smile, and to incorporate more humor into your life to alleviate the stress? I mean, I know I'm like you. I love a good joke. I love to laugh. But it's essential, right?
Well, you're talking to a man whose father, may he rest in peace, was a professional comedian. So my perspective on this is a little biased. However, to illustrate, one of the things that he taught us is to pretty much laugh at anything you can, because we're here only for a finite period of time, And what better way can there be to counteract stress, anxiety, than to make fun of some things? Lighten the load, make it happy, make it fun, make it silly.
And laugh at yourself. A lot of people
Absolutely.
don't know how to laugh at themselves.
Absolutely.
You really have to do that, right?
Absolutely. Absolutely.
So it's very, very important. Incorporate as much humor into life as you can.
Like they say, laughter is truly the best medicine. And with that, we're going to say goodbye for now. I'm Dr. Jack Hauser. Thank you so much for joining me today on Pulse Nation. We'll see you soon.